Coming to you live from PRS View Studios, this is your Plastic Surgery Minute.
At what age should a child have microtia reconstruction?
Well, I think this really depends on what type of microtia reconstruction. I personally do autologous reconstruction, and typically the earliest that I would start would be around 5, and that's only if the child is really sort of grown to the appropriate size where we have enough rib cartilage. Very frequently, 6 is what I usually tell patients, and I usually tell the parents, well, and also if they're a little smaller, it could be later too. Now, if you're doing other types of microtia reconstruction, like if you're putting in a MedPort implant, which I don't do, those kids can start a little earlier because you really don't need the rib cartilage to do it.
What is the recovery like for a child who's undergone microtia reconstruction?
So there's a couple of stages in autologous reconstruction. So starting with stage 1, that's where we take the rib cartilages and carve it and bringing it up under a skin flap. I would say I usually keep patients in the hospital for about 24 to 48 hours. And then afterwards, they're staying away from PE for maybe about 4 to 6 weeks or so. Sometimes a little longer depending on if they have low wound healing issues. And then afterwards, 6 months later, they'll come back for the second stage. After the second stage, then it's a little bit shorter because we're just doing pretty much the temporoparietal fascial flap with a skin graft over the temporoparietal fascial flap for elevation. And that typically is like, in the hospital maybe overnight, and then at home, out of school for at most like a few days to a week or so. Then they're back in school. They stay away from PE for a little bit until they're totally sealed, and they can go back to doing what they like to do.
Oh, great. That's very helpful. Thanks so much, Justine.
Oh, you're welcome, Heather.